Mercy Health Partners want you to know more about congestive heart failure and heart health as we honor American Heart Month. The Mercy Circle of Caring presents Healthy Ideas.
One thing that patients might be surprised to hear about heart failure is that it's actually more of a symptom than a diagnosis. What I mean by that is that when your heart is working inefficiently, we have to work to find out what about your body is causing your heart to have this trouble. There are a long list of medical conditions that can contribute or lead to heart failure. These could include a chronic lung condition, or perhaps you've had a heart attack or heart disease, kidney failure, thyroid disorder, severe anemia, excessive consumption of alcohol over a prolonged period of time, or even a severe infection. And so beyond trying to alleviate the symptoms of heart failure, we as doctors have to work to try to figure out what's causing your heart failure. There are a number of things that we have to do in order to try to help keep your heart failure under control once you've been diagnosed. At that point, more than likely, you're at least have encountered a cardiologist and will continue to see them on an ongoing basis. Depending on what led to your heart failure, there might be other medical specialists that you're seeing too. One of the most important parts of my job as primary care is trying to help to continue to educate and encourage you to make regular follow-up visits with those specialist providers. Also, you're going to be on a number of medications, both for the symptoms of heart failure as well as to help control the condition that caused it, and trying to help out in any way that I can for the patients to understand why they need to be taking those medications, and also to be able to afford and continue to take them regularly is important. We're very fortunate to be living in an area where there are many services available to help heart failure patients outside of just going to the doctor's office and taking medications. For example, most people who have heart failure will have to be careful about their sodium intake in their diet, but they might have an underlying condition causing their heart failure that could be worsened or improved by certain aspects of their diet. And so consulting with a nutritionist might be a good idea or a helpful way for a person to keep their heart failure in better control. Also, if you've just experienced an episode of heart failure, with the approval of your doctors, you might benefit from various cardiac or pulmonary rehab to help with your heart or lung strength to help prevent heart failure from happening again in the near future. Beyond that, once you've kind of done your rehabilitation, there's various exercise complexes associated with the hospitals in the area that you might be able to establish at to continue to get regular workouts to help keep your heart and lungs healthy. Finally, if you find yourself having more frequent problems with heart failure, where you end up going to the emergency room more often than you'd like or being in the hospital more often than you'd like, perhaps having home services and visits from a home nurse would be beneficial for you as far as trying to keep track of your weights, help you to take your medications, and even provide higher level of care in your home that might keep you out of the emergency room and better under control.
Thanks for visiting Healthy Ideas.